tell the difference between this and this? I mean, I'm asking because I don't know, and that's why I kind of did this video. In this video, dermatologist Dr. Adeline Kikam, known on these internet streets as BrownSkinDerm, she's gonna be here talking to us about how certain skin conditions present in brown and black skin. Because what you might think is nothing, you know, you might need to carry your behind down to the doctor and get that checked out. All right, here now, as a little disclaimer, nothing in this video should be taken as a consultation nor a diagnosis. And if you have something that looks like what we're discussing here in this video, the idea is to go to your doctor. So keep watching.
Hi everyone, I am Dr. Adeline Kikam. I'm a board certified dermatologist. I specialize in medical and cosmetic dermatology. I use my platforms to educate on skin of color or skincare in melanin rich skin. And it's a super pleasure to be joining Danielle on this channel to talk about some common conditions, common dermatologic conditions in skin of color for you guys today.
So Dr. Kikam, what is that? What is that?
Okay, Danielle, what you're looking at right now is idiopathic guttate hypomelanosis, and these are smooth off-colored white or hypopigmented spots that typically appear on sun-exposed areas of the body, and they can appear in any race or ethnicity. However, they're more striking in appearance on darker skin tones, and we tend to see this on sun-exposed areas of, you know, the upper body, like the arms, forearms, and legs. We don't really know what causes it, but we know that it's associated with aging. However, I've seen this on way younger people, so don't be surprised if you're in your 20s and you still see this. We think it's a progressive condition in which the skin loses pigmentation in those areas. So it's not dangerous at all. There's no severe outcomes associated with this. It's only cosmetic, you know what I mean? Like, the aesthetics of it is usually the only issue. Some people don't like them, but these are non-painful, non-itchy, and so we tend not to really treat them. However, if someone insists on treating them, we could try chemical peels, topical retinoids, lasers, microdermabrasion, cryosurgery, but all of those come with their adverse effects and they're not all the way useful. So you're not probably going to get, like, you know, these wonderful results where, you know, everything just disappears. It's like sometimes they're effective in just improving the cosmesis and getting you an even skin tone. However, we just really encourage use of sunscreen because we noticed that sun exposure, long-term sun exposure would lead to these spots. So if you really want to prevent them, and prevention is always better than, you know, cure, so you wear your sunscreen not only on the face but on sun exposed areas of the body, or sun protective clothing.
Now this next one, to me at first glance, looked kind of similar. So Dr. Kikam, what is that? What is this?
So Danielle, what you're looking at right now is an image of Tinea versicolor. Those are the hypopigmented spots or patches that you're seeing on the skin of this individual. So what is Tinea versicolor? Tinea versicolor is a condition that is caused by a yeast that is part of our normal flora, and that is Malassezia furfur. So we don't consider it an infection. It's just an overgrowth of this yeast that is a normal part of our skin flora, right? And when you get Tinea versicolor, it presents with these hypopigmented patches because the yeast secretes enzymes that affect melanin production, and one of them is azelaic acid, believe it or not. And we use azelaic acid for, guess what, hyperpigmentation, right? To clear hyperpigmentation. So I just think this is amazing that we've been able to, you know, flip the use of this enzyme that is being secreted by this yeast for other problems on our body. So you typically find Tinea versicolor on places like the upper chest and back, the abdomens, the upper arms. Rarely you would find Tinea versicolor on the legs and the faces, mostly on these areas. And we start seeing them around adolescence or your teenage years. Why? Because this yeast is what we call lipophilic. It loves an oil-rich environment. So at that age, that's where your hormones are changing, and then you're having much more oilier skin, and we start seeing the breakout. So this yeast loves it. And then if you stay in tropical areas or humid areas, that's another thing that can really precipitate this. Every time I travel to tropical areas, I see this on a lot of folks. The good news is it is not dangerous. It's just merely cosmetic. So a lot of people, go on and just live with it because it can be, really hard to treat sometimes. But to treat it, we can use topical antifungal or anti-yeast ingredients in our shampoo, like zinc parathion. We could also use sulfur, selenium sulfide based shampoos. We just, use it as part like a body wash, leave it on for 5 to 10 minutes and rinse off. But if over-the-counter or topical creams and ingredients don't work, we also have oral antifungals that you can use. However, this condition is very resistant to treatment. So some people find that it would clear and then come back. But overall, it's not dangerous.
So we just looked at two conditions that people may confuse it with, maybe like vitiligo. What are some of like the key physical differences between these three different skin issues?
Overall, with idiopathic guttate hypomelanosis, those raindrop appearance kind of like very tiny. Tinea versicolor on areas like the upper chest and back where you have more sebum rich skin, and wider hypopigmented patches versus the very tiny raindrop appearance of your idiopathic guttate hypomelanosis. And then with vitiligo, of course, that could just be anywhere and different patterns. Even in vitiligo, you could have like small depigmented areas depending on the type of vitiligo. So it can get really confusing to the untrained eye. So to me, I just say if you're having, or you think you have any of these conditions and you're concerned, just go into your dermatologist and have them look you up really close.
All right, so Dr. Kikam, what is that? What is it?
So what we're looking at are several pictures of psoriasis. Psoriasis is an autoimmune condition that can affect many areas of the body, including the scalp, the face, knees, and what we're seeing in this picture, the dorsal hand. Basically anywhere on the body, even in the groin, underneath the breast, what we call inverse psoriasis. And it's an autoimmune condition in which the body is just producing skin at a faster rate. So it appears with this thick plaques of just skin and with an overlying silvery scale. Now, in skin of color, this would appear more purplish in color along with the silvery scales. In Caucasian skin, we see more like underlying redness with the silvery scale. For some people, psoriasis is going to be hereditary. For other people, it's just idiopathic. What does that mean? It's just like for whatever reason, your immune system decides to attack your body and you get psoriasis. Just like many other autoimmune conditions, there may really not be any rhyme or reason why you end up with psoriasis. Now, how do we treat psoriasis? When it comes to treatment, we have topical therapy, then we have oral therapy, and then we have light therapy. So there are different types of therapies depending on the stage or severity of your psoriasis or the body area that it covers. But just keep in mind that with psoriasis, there is no cure. So everything we do is aimed at controlling the condition, reducing your outbreaks. And what you can do if you have psoriasis is also to modify your lifestyle and diet. Try to keep stress at a minimum or very low, because even stress can sometimes bring on or exacerbate your psoriasis. So you just try to eat really good, eat a balanced diet, be active, and just lead an overall healthy lifestyle. That can help minimize some of the stress on the immune system.
Dr. Kikam, what is that? What is that?
Okay, what we're looking at is Acanthosis nigricans on the neck, a very common area to have this condition. So Acanthosis nigricans usually presents as this velvety plaques of darker skin in areas like the neck, the upper back, the chest. even on the axilla. We can even see it in the groin sometimes, on the knuckles, and there are different types of acanthosis nigricans and different causes. So it is associated with obesity or being overweight. It's associated with PCOS. It's associated sometimes with contraceptives. By that I mean oral contraceptives. And it can also be associated with diabetes. So sometimes when we see acanthosis nigricans, what we want to do is get a workup for diabetes, because it could be that you are in a pre-diabetic state or you already have diabetes. Now, with acanthosis nigricans, solving or resolving the underlying cause is what really makes a difference in terms of clearing this condition. So if it's due to obesity or weight gain, then weight loss, getting that under control, you would see a resolution. You could use topical ingredients to decrease the cosmesis of it. Things like exfoliants like lactic acid, glycolic, salicylic acid exfoliants, or even topical retinoids. You can apply it there and help exfoliate some of that buildup. However, it's not going to totally clear it. What is going to make the most difference is addressing the underlying cause of why you even have the acanthosis nigricans in the first place.
Now, last but not least, Dr. Kikam, what is that? I mean, I know what it is, but what is that?
Okay, oh my God. So what we're looking at, it seems to me like someone who has had a sunburn. Sunburn can happen in darker skin. That's what some people fail to realize, that sunburn can literally affect all skin types, even darker skin types. Now, when it comes to sunburn in lighter skin types, it's quicker to sunburn than darker skin types due to melanin. So it's very important that you wear sunscreen. The unfortunate truth is this: many people with darker skin are going to sunburn and not even know that or realize that they've sunburned, because the peeling in sunburns don't happen even sometimes from 6 hours to 48 hours after the inciting sun exposure. So I always hear from people, some of my patients, that will go on vacation and then it would not be probably until a couple of days or even a week later that they start seeing severe peeling or pain to the area. Get out of the sun immediately if you realize that you're getting a sunburn, you've been out there too long. And then usually you would feel a rise in temperature in the area a couple of hours after your sunburn. Make sure that you apply some form of like cooling type of agents in the area, whether it's an ice pack or getting into some cool water to bring down the temperature, and then applying a calming anti-inflammatory ingredient like an aloe-based product, taking an NSAID to calm the inflammation. If you have access to hydrocortisone, you could apply it to that area. Don't be surprised if after a couple of days or weeks you start peeling in that area. It's just like your body getting rid of that damaged skin. What you don't want to do is peel it off, go picking at it and actually peeling it off. Please don't do that. It can be very painful, and I would not advise it, because now you're exposing premature skin cells to just the environment. So just let it be, let it peel, and let the scales fall off by themselves.
Now, don't you go playing WebMD out here, right? If you see something that concerns you, the idea is to go to your dermatologist to get it evaluated. If you don't know a dermatologist, you can ask your doctor for a referral, or check out a video that I've done on how to find a Skin of Color pro in your area. Thank you again to Dr. Kikam for coming on the channel and spreading her knowledge. If you want to follow her here on YouTube, Instagram, TikTok, and the like, I will leave the information in the description box. While you were in the description box, make sure you follow the links to follow me on social media, and there will also be links to things you might want to know, like things I'm wearing and so on and so forth. And I'll see you fine folks in my next video. Bye guys.